So you talked about your mission statement, and I know that my mother had her both hips replaced. And so in your sense, what would you say the replacement surgery, is there something better? Of course.
Absolutely.
So could you embellish
She should have never had the hip replaced. Now,
but that's all she knew.
Exactly,
Yeah, so,
and that's why this show is so very valuable, because it gets that information out to people that says, look, just because somebody tells you you have to have a hip replaced because you're bone on bone, that's not the only alternative.
Okay.
The other alternative is ask yourself two simple questions. Why am I bone on bone? And where did the problem come from? And until you can answer those two questions, then you should never, ever have hip replaced surgery. I'll give you a very simple analogy. We do about 150 to 200 patients a month, and we prevent them from having what your mother had.
Oh, wow.
Okay?
Yes.
And the way we do it is by conveying to them that think of yourself as an automobile and think of your muscles as the shock absorbers.
Okay.
So you and I are getting to know each other pretty well here. So I come out and I say, Tina, let's take all the shocks off your car. And let's just drive around Minneapolis for a while. It's going to be a rough ride,
yes,
but we're not going to do a significant amount of damage. And then I say, Tina, let's get your husband and let's go fishing in Alaska. Well, by the time you get back from Alaska, you're not going to have a car. Why? Because it's going to be metal on metal. What happened? The shocks are gone. The muscles are the shocks. So when you come back, do you throw away the car? No. You put new shocks on it and it works fine. All we do is work on the shock absorbers, the muscles, getting them to absorb the forces coming into the body. That force never goes to your mother's hip. She has no more pain and therefore no need for surgery.
Wow.
It's just that simple.
And even the recovery time that it took for that. Yes.
If she had surgery and a 6-month to 9-month recovery, our recovery time is about 5 weeks.
Right. And
so either we prevent you from having the surgery, or if you have to have it, and there's some cases where you have to have it, we shorten that window of time that you have to live in pain.
Wow.
Without drugs.
Yeah. And what a great way, quality of life to have that. Yeah. So Dennis, this sounds like such a superb device that I would like for you to do a demonstration. And I guess that we have a gentleman here, a retired firefighter that has having some back issues that we're going to bring forward, and we're going to do a demo on him.
Great. And I think what we'll do basically is to show how it immediately impacts the muscle and relaxes it. So when you're in pain, a muscle is bound up. So instead of being out here when you were a child, it's about right here. So it becomes very uncomfortable. What we'll do in seconds is just simply send a neurological signal to that muscle to relax the muscle, and we'll be able to demonstrate that here on camera.
Okay, that sounds perfect.
Okay.
Well, we'll invite our guest.
All right.
So welcome.
Hi, Dennis.
Hi, very nice meeting you.
Nice to meet you.
And let's just give you a real quick test. Now, what level of pain is your back normally? 10 would be very, very uncomfortable. 1 would be no big deal.
Probably about a 4.
Okay, and that's constant most of the time?
Not really constant, but at times it's worse than others.
All right. So what I'm going to do right now is just simply test your range of motion. And there's good restriction right about there. Would you agree? Okay. And a little bit better on this side, but still restriction right there. Okay?
Yeah, I can feel that tightness.
So what I'm going to do right now is I'm going to send an electrical signal to these muscles that are tight to instantly go from this position to this position.
Okay.
That fast. Okay, so I'll turn this on, and then we'll put these electrodes on, and we'll have you turn around and we'll show the camera exactly where we're going to put the electrode.
So is this something I'm going to feel, or?
You might feel just a little tingle, nothing more than a tingle, but your brain and your nervous system will pick up on it instantaneously. And that's all we're doing, is sending a neurological signal to basically relax those muscles. Right now they're in a red light. I'm going to take them to a green light in about a 1/16 of a second. Okay, so I'm just going to turn this on, put this right here, slide that down. Let's have you turn around.
Okay.
Tina, thank you. And what I'm going to do is just set our machine up here. And we'll put a couple minutes on here. We'll start you up. And you tell me when you very first feel like a tingle. Okay. Any sensation whatsoever, okay? And here we go. Tell me when you first feel anything.
Right about there.
Okay, good. Okay, so now your nervous system has sent the signal to these muscles to relax. Your brain doesn't know it. So I'm going to move you so your brain picks up on the fact that you can now move like you did when you were a 3-year-old. So I'm just going to move you, and with that current on, we're just going to keep twisting and quit twisting and twisting.
Oh.
And now we're going to go here, and we're going to do exactly the same thing.
Wow.
So as a golfer, you can imagine what that does to your drive.
Oh, yeah.
It adds anywhere from 25 to 30 yards immediately to your drive. And this effect will stay with you for about 5 hours.
Oh, okay.
Okay? So I'll turn this down, and we are done. And now, with the current off, you'll be able to see that you still are going to retain that.
Wow, you're going to have a heck of a good golf swing now.
And
So,
it should feel a lot lighter.
If you said it lasts for like 5 hours.
About 5 hours.
So
Then it'll go back to its normal homeostasis. So let's say you're one of our patients, and you normally are in pain of 8 or 9 every day.
Sure.
Just by doing what I just did right there, your 8 or 9 tomorrow will be a 7 or a 6.
So it gets better
Progressively
with each treatment.
Okay.
Okay.
And each treatment is typically about 15 minutes. We spent
Oh,
about
yeah, okay.
12 seconds
Sure, okay.
doing that.
All right.
Okay?
Okay.
So it's a prolonged process that shortens everything down.
Okay. All
Okay?
right.
Thank you very
Dennis.
much.
Yep.
Sure.
Thank you so much.
Thanks, Dina.